posted on a recording of the webinar, and the slides will be posted on the website of TEA and also Houston Health Department. Next slide, please. Yes. Yeah, a cooperative agreement between the Houston Health Department and the U.S. Department of Health and Human Services made over 69 million USD available for the support of schools within the city. And this includes both the public and the private schools, and also charter schools inclusive. The testing is voluntary both at school level and individual student or staff level, and it's available to everyone within the school at no cost to the school or to the individual student or staff. Next slide. So why do we want to test in schools? Why test in schools? More so, we have some off-site testing avenues across the city or state. On-campus testing brings testing to your doorpost. And with regular testing, we are able to prevent the occurrence of an outbreak that might lead to the closing of schools or occurrence of illnesses among our staff and students. Should we miss out prevention, we can easily and promptly detect an ongoing spread, as science has shown us that transmission of COVID does take place among individuals who are infected but do not show or experience any symptom. The Houston Health Department has since last year supported the city in implementing public health interventions towards the containing of COVID-19, whether in case investigation, contact tracing, vaccination, and so on. And that we will sustain and we intend to keep even among our school population. Containing any school outbreak ensures continued in-person learning, and that we know is your goal as well. Next slide, please. We have different types of tests and various categories of testing. And what is the take home on this slide? On the left side are categories of testing, be it surveillance, screening, and diagnostics. And on the right are the types of testing. Antigen, the PCR, which is also the molecular or polymerase chain reaction, and an approach on the PCR, which is the pool testing, not a type on its own. The Houston Health Department will be supporting your schools along the various three categories we have on the left. This will get clearer as we proceed with the presentation. We intend to support you with routine testing based on the community transmission rate within the zip code your various schools are located within. Both asymptomatic and symptomatic individuals would be tested once the team arrives at your various campuses. As soon as some of you might know, we have the antigen test, we have the molecular or PCR, and the pool testing, which I said is not necessarily a type or an approach. Next slide, please. All right. The antigen test is the one that yields a rapid result. Within 15 minutes, you have your result. It's said to be particularly useful in identifying persons who are near or at peak of the infection. But that's a little dicey because I'm not sure how many people know who is or when they are at the peak of their infection, especially for asymptomatic persons. The antigen test is known to have less accuracy compared with the molecular test. And if an individual is not at the peak of their infection, it's likely to generate what we call a false negative result. Also, symptomatic persons who test negative, so you have an individual with cough, catarrh, and all that, who tests negative with the use of an antigen test is required to follow up with a PCR test, as that's the gold standard for testing presently. The molecular PCR is more sensitive and the positive results are highly accurate and more reliable. Since this at no cost to any of your schools, you would not need bother about the cost or how expensive it is. But also on the con side of PCR is that the turnaround time is not as fast as the antigen. But with the program the Houston Health Department is implementing, a 24-hour turnaround time is expected. For reasons related to inability to pinpoint who particularly is positive in a pool testing and a need to have a retest done at individual level, the department would not be implementing the pool testing. Next slide, please. Yes, as we all know, schools do not exist in isolation of their surrounding communities. As such, recommendation on testing frequency is what is demonstrated on this slide. Schools located in zip codes with high COVID transmission rate and a low vaccination rate, as you might see in the last column highlighted in red, and has a high community vulnerability index are recommended to test on a weekly basis. While schools that are located in zip codes with moderate transmission and a moderate vaccination coverage and not so high vulnerability index, they're recommended to test once in a fortnight, once in 2 weeks. Schools that are located in zones or zip codes with low transmission rates, high vaccination coverage, and low vulnerability index would not necessarily need routine testing. However, requests to conduct testing would not be turned away. Next slide, please. Yeah, this slide is a demonstration of how the test and frequency recommendation was arrived at. The map on the left with brown highlights show the cumulative COVID positivity rate in various communities within the city of Houston. The darkest shade of brown represent communities with high transmission rates, and the creamish or whitish center, which you can see, represent zip codes with lower transmission rate. On the other side, which on the other side of the slide, the right side, is the vaccination coverage. This is a corresponding map to the first one on the left. The right one shows the vaccination rates, and the wineish or darkish brown looking ones, zip codes, are the zip codes with the least vaccination coverage. While that center, which is whitish now, as you can see, are zip codes with a high vaccination rate. And you can see communities with high vaccination rate actually have low COVID positivity rate. Next slide, please. With all said, the Houston Health Department, in collaboration with the Fulgent Laboratory, will be providing schools located within the city of Houston with PCR testing. Qualified personnel will be deployed to schools to assist with swabbing. And this on-campus, there will be on-campus collection of shallow nasal swabs from consenting students and faculty. And this includes both teaching and non-teaching staff. We're expecting a turnaround time of 24 hours, and results, both negative or positive, will be shared with parents of tested students and staff who test. Individual staff will receive their individual result, and parents, individual parents of students who test would also receive theirs. This is a confidential process, and privacy is very key. We also will be supporting with ongoing monitoring of COVID within the school population and the communities in which they exist. Next slide, please. So how can our schools or your school participate or partake in this testing program? This is simple. Can you click on the link, the first one, Damon, please? Yes. So this link takes you to a page where you can provide a brief on your school. It has our contact phone number and email address. Can you scroll up a little? So give us the location, the name of your school, the type of school, the grade to care or teach, and also the details of the contact person that can serve as a liaison between your school and the Houston Health Department. You can scroll up a little more. You also might want to provide us with information on any existing testing policy you might have, and also whichever one you might want to, which path, whether PCR or antigen that you might want to embrace at this time. And the testing team will definitely reach back to you, providing you with the next steps on policies and the time of test and other details that are beneficial. We also have, can we get back to the other slide? The main presentation, yeah, thank you. So we also have our email address here with which you can ask other questions, and we will be happy to feed you back or respond to you as quickly as possible. We also have a page on frequently asked questions. Can you click on that too, Damon? The third one. So this takes you to that site where all the questions you might have in mind is already answered, and we also look forward to updating this. We also have on the site news release on what the mayor and other experts within our community are recommending as regards school testing. Can we get back to the other slide? Yes, so at this point regarding antigen testing, next slide. The department is aware that some schools within the city of Houston have had a previous engagement with the state on antigen testing, and we're working to see how this can be sustained in a seamless manner, collaborating with DSHS and TEA. And at this point, I would hand over to Mr. Hoyle Damon to share the needed steps for schools that are looking forward to having antigen test kits or testing within their campus. Over to you, Damon.
Thank you, Dr. Abby. Good afternoon, everyone. My name is Damon Hoyle, and I'm here with Texas Education Agency and the State Health Department dishes. And so we're now going to move into the section to talk about, as Dr. Abby said, what TEA and dishes will be supporting the Houston Health Department and the schools on that City of Houston list with regard to antigen test over the next couple of months. So I'm going to move to my next slide. So the eligible City of Houston set of public and private school systems, and I'll click on that in just a second, can apply to be a part of the TEA school year 2021-2022 COVID-19 testing program. And what's going to happen is you all would be eligible if you want to apply. You would receive antigen COVID tests through some vendors, and we'll get into those details. And should you choose to apply, you're going to receive the reduced allocation just because, and the reason it's reduced is because the other school systems that are not within the City of Houston, they're getting allocated funds for the entire year. You all would be getting it for 2 months. And so that's why it is reduced allocation, but it's the same amount for those 2 months of the other schools in terms of it being equitable. So then after November 15th, you all would then transition back to the Houston Health Department to get that support for those antigen rapid tests. And so what I'm going to do now, just to ensure that the right folks are in the room, these are here we go. So these are all of the schools that are on the City of Houston list. It's about 148. And these are the school systems that we're excited to help support when it comes to providing antigen or access to antigen rapid tests. So I'm going to move back to the slideshow. And then one other thing, if my colleague, I know some of my colleagues aren't here, if we can drop this in the Q&A chat, I'm going to be toggling back and forth and be referring to a lot of the resources here at the TEA K-12 COVID-19 testing project site. And so here it is. We provided a lot of resources. So as I mentioned certain things, this is where you would be able to find it. And I'm sure they're going to drop that link in the Q&A for you so that you can click and toggle back and forth. And there will be a Q&A at the end. So we'll get to your questions if we don't get to them throughout the presentation. So City of Houston public schools. So there's two. There are public schools and private schools in that list of 148 schools. If you are a public school system and you were previously enrolled or opted in to the past testing programs, meaning we had one in August, which is our stopgap program, and we had one last school year for the 2020-2021 school year. So if you're a public school, K through 12 public school, and you've already opted in, you do not need to reapply. And I'll get into the application in a second. You do not need to apply again. We'll show you the allocation sheet. You'll see how you've been noted. But if you are a private school, regardless if you've opted in the past, we do need you to reapply if you've not applied already in the last week or two. And the reason we need that is, as TEA, we have access to all of the public schools information, but as private schools, we don't have as much access to your information. And we want to make sure we have the most up-to-date info so that we can provide you with those antigen tests and your needs with that. Now, this is completely optional. You do not have to engage or request antigen tests, but if you would like to, here's some things that you would need to attest to in terms of requirements. The first bullet point, the big piece here is that you're going to adhere to the reporting requirements that are set forth by the vendors and set forth by TEA, and failing to do so could result in not being able to further participate in the antigen test, us providing that. The second bullet point here, you will affirm that you've read the requirements and that you can meet those requirements. And it's all in the application. We also have an eligibility document that I can show you that lists out everything there for you. Bullet point number 3, each district that chooses to participate needs to identify one district test coordinator. And that's the person that's gonna be in contact with TEA and dishes, as well as the vendors who are going to be providing the antigen test. So this is that district liaison who's going to be helping coordinate all of those logistics and so forth. So you would need to identify that one person if you haven't already. If you've opted in the past, it would be the same person that you've already had, because that's who we have on record. If you want to change that, we have a process for that as well. The other piece, you would need to ensure that you have appropriate space and can meet the space and storage requirements to accommodate the tests that you receive. So a lot of the antigen tests might have a room temperature requirement or a spacing requirement. You're attesting to that you will have storage or a place to store these within your district or at the individual campuses that you choose to do antigen tests. And then the last bullet point here is, as previously required for all public schools, so this is just for public schools, you must report every Monday that same dishes report by 5 p.m. your positive cases. And I will click here. I believe the link is still, but there we go. You would still fill out this form. This is only for public schools every Monday by 5 p.m. So that is still a requirement with this. All right, gonna go back. And as you have questions, please drop them in the Q&A. We do have time at the end, as we said before, to answer them. And we might be answering some as we go along too via the chat. Now, to reiterate, who's eligible? I'm going to give you guys time to look at the chart, and then I'll go through it briefly. So let me give you some time to look through it. Okay, so as you can see, if you should apply, I'm going to start with that column going up and down, north to south. If you should apply, a public school district, and I've already kind of reiterated this, if you have never applied to any of the TEA dishes testing programs in the past, and you wish to take part in these antigen tests, getting access to them, then you would need to apply to the application. Now, if you offer pre-K or daycare and they commingle with K through 12 students and they are attached to that building, then those campuses still would be allowed. We still would cover, although it says K through 12, those pre-K and daycare students, if they're on a campus with K through 12 students, they would also be allowed to have access to these COVID antigen tests along with those staff members. And this is the same for private schools. The only difference is for private schools, it doesn't matter who you are, whether you've applied in the past, you would need to apply again. So public schools, if you've already applied, no need to apply again. But if you've never applied as a public school, you need to apply. Private schools, all of you would need to reapply if you haven't done so with the new application that's been out for about a week and a half now. And that's just so we can update our information. And the same pre-K and daycare piece goes there. If the pre-K or daycare is attached to your campus, then you're good to go. If it's not, then that's something different. Who should not apply? I've already kind of reiterated this. Public K through 12 schools that are already that have already in the past been in the program. You do not need to reapply. We have your information. We're good to go. Who isn't eligible to apply? And I don't think that's anyone on here, but just in case, if you are a pre-K standalone campus or daycare facility that stands alone, meaning that you are not attached to a K through 12 campus, you would not be eligible to receive these antigen tests. And that is a stipulation laid out in the grant guidance. And that's just because it needs to be, needs to be attached to that K through 12 campus and commingling and existing with those other students. So I'm going to move on from here. So I've mentioned the application several times. So now I'm going to click on it. The application is also on our website, the website that I showed you all earlier. It is there for you to go and apply if you choose. Here is what it looks like. It is pretty simple. The first part of it just describes the background of the grant. It walks you through all of the eligibility that I've gone through, but just in more detail. It even has a part here specifically about the city of Houston, which I've already said, it just echoes what we've talked about through November 15th for Antigen Test. It gives you a list of those schools and so forth and eligibility. It then goes on to talk about the different considerations and requirements that I went over in a few slides, previous slides. It gives you a couple of links to our website and our COVID case email if you had questions, and then there's a required notice there. As you go forward in the application, you either pick private or public. If you choose public school, here's where it's going to take you. You would go here, you choose your ESC region. Since this is ESC 4, because you guys are in Houston, you would choose ESC 4. And then there's a drop-down menu that automatically populates all of the public schools in the city of Houston. So you would go there, choose your campus. Let's say I'm Alief ISD. You would go here, you would read what it says. You would fill out the information. And I'm just making something up just to kind of guide you guys through it really quickly so you can see. COVID case report. If the email is not valid, it will reject and it will not let you proceed. And that was done purposefully. So if the email that you put in here is not valid, it will not accept it. It verifies emails. I'm going to put the TEA phone number here just so you guys can see. Copy and paste it down here. Speed this up a little bit. I'll just say test. And then it takes you to, you're going to attest to these 3 things. And then you would fill it out. Whoever the submitter is, your name, you would fill out your title. Once again, put in your email address. And then once this is done, it will submit it for you. And when I click forward, it'll submit it. Now I'm going to go back for our private schools really quickly. If you're a private school, it takes you to something a little different. It asks that you put in your full private school name. So your full name that you would put on any official documentation. If you have a TEPSAC number, put it there. If you do not have a TEPSAC number as a private school, put NA, and then we will provide you with an ID, a unique ID number, so that we have that extra layer of identification. Put your full street address, not a PO box, but an actual street address where tests can be delivered. Put your city, your zip code, and right here, I know it says K through 12 staff and students, but we just said it right here. Pre-K only shouldn't do it, but if your pre-K are attached to the K through 12, then you would include those pre-K staff and students right here. So if you have pre-K teachers and staff, you include them in that K through 12 staff. If you have pre-K or daycare, K through 12 student enrollment here, if they're attached to the school and they commingle. So that's the distinction there. You go through, it leads you through that same attesting to those 3, and then you submit your application. So very simple, shouldn't take more than 10 minutes if you have the information, and you should be good to go. So that is the application there. And actually, well, I'll go forward and I'll show you at the end. So how does it work? Allocations, I'm sure you worried like, so how does this work? So we have posted a list of opted in public school systems and their allocations. So what happens is every school is given a certain amount of money. The state of Texas received $800 million from this grant. A certain portion of that is going towards this funding specifically for these vendors that I'll get into. Every school, based on their student and staff population, was then, through a formula, allocated a certain amount of money to then use to purchase tests from these vendors. As you purchase tests, it will be deducted from your overall allocation, and then the vendor will bill dishes and they'll take care of it. So none of this money comes directly from you. Private school systems, for right now, we don't have your allocations up for the city of Houston, but it will be updated by this Thursday. So if you don't see your name, which I'm going to click on now, for public or private schools, we will be updating this by Thursday. So let me exit out, and I want to do it this way. Let me go. I think you guys can still see my screen here. Let me do it this way. You all can still see my screen, correct? I believe I'm still sharing. Okay, so if you go here and we go down to, you're at the TA COVID website, and you go down to tools and templates, we're gonna go to K through 12 public schools allocations. If you go there, you will see a list of all the current public schools that we have listed. And then it's going to tell you if you're a City of Houston school. What we're gonna do by Thursday is let you know if you're currently opted in. It has your name, it has your district enrollment, student enrollment, staff, total population, and then there's an allocated amount. For the City of Houston schools, you'll see yours is set out because it's just a 2-month allocation. And this is the amount of money you have to spend on rapid tests over the next 2 months. And this is based on population. So now let me go back. And then the same thing will be for private schools. Once we update the list, private schools, you will be added to this PDF. You're not there yet, some of these Houston schools, but by Thursday, your allocations will be there, and it's the same piece. You'll know your full amount that you have to spend on rapid tests over the next 2 months. So I'm gonna go from there, go back to my slideshow. Let me reshare. Went too far back, let me scoop. Sorry about that. We'll go quickly forward. Little recap for you there. And we are now here. So looking at this, that's the allocation piece and how it works. Like we said, it's a reduced amount because it's just for 2 months. I think people can still hear me. Okay. So school systems, kind of already explained this, will have a dollar value of allocation for testing services. Each month, TA will provide school systems with an update on their expenditures and remaining balance. So as you spend more money, we'll let you know in November 1 how much you spend in October and how much you have left to continue to spend and to continue to use on Antigen Test. And when I say spend, that's just the bank amount of allocation dollars that you have. It doesn't come from you. That's just what the state has set aside for you. But your school is not directly billed. It will be billed to dishes. The vendor will bill dishes, the state health department. Tests provided under the K through 12 COVID-19 testing program are designed to be used immediately. And we stress that because this is not to be stocked and hoarded. As you get the tests, use them. Expenditures will be monitored to ensure that systems are not expending more than 20% of the allocated funds in a given month, except for extenuating circumstances. This is not a big of a deal for you all because you're going to be in the program for 2 months, but we put this in place so that folks are not using up all their dollars in the first 2 months, and then you don't have any money left for the rest of the school year. TA and dishes will compare test reporting to test orders. So as you order your test, and I'll get into that in a second, as you order your test, we're going to compare what you ordered to what dishes has been billed to make sure that we reconcile it and that things are accurate. And so that as we update the allocation document, that it is truly reflecting what you have left. We want to make sure that you are not being given anything short of what you should have still in your bank of money to spend. In short, we ask that school systems develop a plan for testing throughout the year or throughout their time in the program. Order each month what they believe they will use for the upcoming month. We know that situations happen where there might be an outbreak that you didn't foresee that we get, but typically those are far and few in between. So please think about what you actually need for the following month. Report those test results thoroughly and accurately and consistently reorder testing supplies and services as needed. So I know that might have been a bit much there. I'm going to now, I mentioned this a lot. Well, let me get here. I mentioned vendors. So how does this work with the vendors? So the State Health Department and TA has already set aside a number of vendors that you all can go to request antigen rapid tests for your campuses. There are 3 vendors that can be chosen. You can choose 1 vendor, 2, or 3. You can choose as many vendors as you want. We're not limiting that. You might choose a myriad of 3, depending on how big your school district is. You might have some going to some schools, some going to other, but you can choose 1 to 3 of them. School systems may select vendors that offer the best services aligned to their testing needs. Vendors, once again, will build dishes. So no one's asking you all to come out of your pocket for any money. Your allocation amount, that'll be billed and it will be deducted from that. And then that's what you will have left to spend throughout your months with the program. So vendors, I'm about to click on this vendor sheet and then we'll go through the vendors. So this resource sheet will help you compare testing vendors to determine which is the best fit for your school system and community. So that one back there. There we go. So here are the vendors. And the 3 that you would pay attention to because you're coming into the program for antigen tests. These are the 3 that currently offer it. Achieve Health Management, Thermo Fisher, and then there is Quest Diagnostics. So these are the 3 vendors that you all as City of Houston schools would go to. We talk about the CLIA waiver at the top so that you know where they stand, how they test collection, scheduling, a good amount of information has been provided. It's a quick sheet just so you get an overview. It's not giving you all the details, but it gives you enough to at least as you start calling, you kind of understand the pricing and so forth. If you have further questions or want to start contacting them, we provided updated contact information at the bottom. So then that's when you would contact them. And then you see it goes to Quest Diagnostics. If you click there, it'll automatically go to their website for you to contact them. So that is the vendor resource sheet. It's also on our website. So as you begin to order your test, this is what you would look at to begin thinking about your plan. And once again, these dollar amounts would then be deducted from your allocation that I showed you on that allocation form. And it'll be updated on Thursday with all you all's information in terms of public schools, and as private schools, as you apply, we'll update it with your information. So that is the vendor sheet there. And I'm sure we'll get some questions to add further clarity. So with anything, there's going to be a reporting component to it. So as you are in the testing program with TA for the couple of months, here are the reporting requirements. I'm going to pause and let you all look through it, and then I'll review some key points. All right, so for all testing, no matter public or private, each vendor will have its own testing requirements. It is your responsibility as a school, as you reach out to these vendors, to adhere to those reporting requirements. Meaning as you get tests, as you get positive or negative tests, whatever it is they require for reporting, you have to do that. That's an expectation, and failure to do so could result in a loss of access to the rapid antigen test. All school systems must fill out a test request form within 48 hours of receiving their testing supplies or services. So we're going to be doing a webinar this Thursday at 1 o'clock, I want to say, and it's on our website. I'll show you to go over this form. The form is just put out there within the last week or so. Basically, as you order your tests and you receive your tests within 48 hours of receiving the test, this is the form you're going to fill out that then Dishes and TA will use once we get the invoice or the bill from the vendors to reconcile, to say, hey, they said they ordered 100 tests, we got billed for 100 tests. Now there's a discrepancy, we can get to the bottom of it, but this is a requirement. For positive cases, same things that have pretty much been the same throughout COVID. Campuses must notify individuals, in the case of a student under 18, notify the parent if there's a positive case. Public school campuses, just for public schools, adhere to the TA public health guidance. And this links to that on our website. This is our public health guidance. So just reading through that you adhere to all of those. All schools, public and private, must notify their local public health authority, which would be your Houston Health Department here. So you know who to contact there. And then public school systems only. For public schools, you would fill out that dishes report that I went over earlier every Monday about 5 p.m. And that's for the health department there, for the state health services there. So that is the reporting requirements. And just so you know, this slide deck will be available on our website and Houston Health Department's website for you all in the coming days, along with the recording of this webinar. Here's who you can contact. For PCR concerns, you will go to the Houston Health Department. If you're looking at when it comes to the antigen test or the TA public health guidance, you will come here. And then if you have questions specifically about vendors, you to reach out to the Texas Department of State Health Services, also known as DSHS. The last thing I'll say before we open it up for about a 20-minute Q&A here, I'm going to click back here. There are a lot of resources on the TA website. So everything that I covered today, and let me blow this up. When I talked about the different webinars, so we have webinars that would have already been conducted. So if you want to go and see more information about each vendor, it is here. It's a recording of the webinar along with their presentation slide deck. So you can see that. The vendor sheet that I mentioned that gives you a brief overview of them, it's there. The COVID test reporting form that you have to fill out in 48 hours, it's here. The allocation sheets that'll be updated numerous of times a week, regularly a week, that's also here. So that allocation sheet is here. And then at the top, we have an FAQ that provides a lot of information about the testing program. So when in doubt, check out our website. And if that still doesn't answer your question, you can always email us at COVID case report, and we'll get back to you momentarily. So with that said, I'm going to go to Q&A. And this will be between TA, DSHS, and the Houston Health Department will answer some of these questions. So how do we require the recording of this call? It'll be posted on the TA website, and then the Houston Health Department is also going to be posting it. So it'll be posted by this afternoon, if not by tomorrow midday. Is there a minimum number of faculty and staff? So this is for, I'll turn this over to our Houston Health Department friends. It says, is there a minimum number of faculty and staff for getting the Houston Health Department to do PCR tests on your campus?
Yeah, thank you, Damon, and thanks for that question. We don't have a minimum. All we are up to is to ensure we have a good representation of students and staff that are tested, and consenting is very paramount in here. So once we have a consenting student, our student whose parents are consented, and our staff, we would actually have them tested. That's it.
Got it. The next question, this is also for you, Dr. Abby. It says, did I miss a discussion of the PCR test? I heard it mentioned as an option with pros and cons, but then only information on antigen test. So, well, I'll let you take that, Dr. Abby.
Sure. Thank you for that again. So we have a link in there. And Damon, can you project the second to the last slide? Where we have the Houston Health Department up there. The first link actually takes you into the PCR test and details that we need. And from there, we would be reaching out to you on when and the how and any other application or policy paper you might need to sign to get you on board on that testing program.
Got it. Okay. The next question, and I think this is more so for us here at TA, it says, what do we do with the current Binex expired test kits? So great question. What we've done, and because there can be a very detailed answer on our website, on our FAQ. You all can see at the bottom of the FAQ, it says previous testing programs, and we go through answering what do we do with those test kits? What do we do if they're expired? It's all here for you. If it's unused, used, expired, it walks you through what to use. I'll just give a general disclaimer. If you still have by next now rapid antigen tests that you received from TDM from past programs and they're not expired, you can still use those tests and you still report it to the Texas Rapid app application online portal that you've been doing like in the past. Once they've expired, then you would then follow this piece here. All components of expired by next now test may be disposed of regular trash with the exception of the reagent bottle, which must be disposed of as medical waste. So once it expires, you do that. We do caution you, make sure it actually is expired. Check your individual test kit lot number and make sure that you're not throwing away good tests. Look at that lot number. This is also on our website because all of the tests were extended. Check that individual lot number here and it'll tell you when the new expiration date is. It'll tell you the original one and then the new one. So you just want to make sure you're not throwing away good tests. All right. We answered that one live. Did I miss? Answered that one live. Would anything prevent the school from participating in a federally funded pooled testing program? So I think that's for you. Want to say, Dr. I'll let you take that one first.
I see that. Mike, thank you for that. Will there be anything preventing a school from participating in the federally funded pooled testing program? Nothing prevents any school from participating in a pooled testing program. The reason the Houston Health Department is not implementing a pooled testing program is so that individuals who test can actually have a true result for each individual. And as stated earlier, should we have a positive pool test result, a pool test result doesn't tell who in particular in the pool is positive, and that will require a retesting of the people or a reswabbing, and that takes a long process. So why don't we cut that off, get everybody tested, and the individual that gets tested receive their individual result? But of course, nothing stops you from participating in a pool testing if you have a provision somewhere.
All right. And then we have, I see one of our colleagues go ahead and you can come off of mute. We have one of our colleagues from Dishes that wants to go ahead and speak. So go ahead, you can go ahead, Shannon.
Thanks, Damon. Can you hear me?
Yes,
speak up just a little bit for us.
Okay, just to clarify, the federal program through Affinity Empowering, they do a double swab for those pool testing. So there is almost just a couple hours delayed response for if there is a positive within the pool. They can pretty quickly then identify who is positive specifically within that pool because they do double swab those people.
Okay, thank you so much, Shannon, for adding that. All right, we'll move to the next one. Will schools continue to use the I've answered that one, but I'll re-answer. Will schools continue to use the TexasRapidTest.org website to report results of the antigen? You use that for the TDM by next rapid antigen test that you received from the prior or previous programs. Any new antigen tests that you receive from the vendors, you follow their reporting requirements. So if it's a previous test that you still have that's not expired, you do the old reporting that you've been doing. If you get new tests from these new vendors, you do their reporting, which will be different. And as you call vendors, they do have a onboarding process where they'll walk you through as a school system, all of what they require in terms of reporting and their tests and so forth. And I would also encourage folks, as I showed you on the website, to go check out those already recorded webinars in the slide deck, because it also gives you that information as well. And each vendor will have its own type of requirements. And so it'll look different per vendor. We'll be emailed the link to apply for the test. So we can provide the link to Houston Health Department. I see someone's answering it, but it's also on our website, but we can also provide that to the Houston Health Department for you all to go, so you can get it directly to your email inbox. So the request is an attestation that we have storage specifics for PCR, but do we know what those are? So a couple of things, and I'm going to answer this, and then I'll turn it over to Houston Health Department. That the 3 attestations that we mentioned are the different requirements, the 3 that are in the application, and then the other requirements. we're saying that for each vendor that you get an antigen test from, they might have their own and will have their own specific storage requirements. When you call that vendor, you would ask them what those are and then see that you could adhere to it. And if you can't, then go with a different vendor. If you can, then move forward with that vendor. Are there any things for PCR testing, Dr. Abby?
Sure. So for the PCR testing, since it's an on-campus testing, we expect that the school will provide a location within the school premises for the testing. For the swabbing to actually take place. We also expect that the school will have a focal person that will liaison with the Houston Health Department and in sharing other information that might be needed. And when it comes to who does the swabbing, who does the packaging and result sharing, that's already taken care of. And results is what individuals would just receive.
Thank you. Will we need to, and this is kind of a similar question, so will we need to report the test obtained by the city through something similar to the Texas? Oh, okay, so this is actually, this is for you, Dr. Abby. It says, will we need to report the test obtained by the city through something similar to Texas Rapid App? So they're asking, what are the reporting requirements for the, I'm assuming the PCR test?
So I know that the schools have been reporting test results to the Houston Health Department since last year. And if this is a rapid test, usually if it's a probable, the rapid test is taken, if it's a positive, it's taken as a probable. And the unit or team responsible for that usually requests for a PCR confirmatory test be done. And luckily we have the team here that might also want to provide some insight into that question. Ramatu is in here. The question is on probable or on the rapid test or the PCR. Do we have them?
So say that again. What were you saying, Dr. Abby?
Okay, so I was making clarification to be sure our other team members are here too. But when it comes to rapid tests results, once it's positive, we take that as a probable case. And usually the department will request that such a person gets a PCR done. And that's what we call a confirmed case. But whether rapid test results or confirmed one, the public health intervention remains the same, and reporting and letting us know is also essential. And I hope I've answered that question.
Got it. Someone says you are correct, Dr. Abby. So good job, Dr. Abby.
So that's the director for that team.
Got it.
Thank you.
Perfect. When is the last day we can submit the Binex Now test? I'm assuming to the rapid app application. Sorry. With that portal, it will, as your tests expire, it will no longer accept those tests. So it's on a rolling basis. So let's say your test expired November 1st. The app is set up to recognize the QR code or the barcode, and it knows when the expiration date is. And so if it expires November 1st, if you try to report a test on November 2nd, it would not allow you to report it. So that's how it's set up. So you can do it up until the expiration date. So, and here's a question, and I'll take it, and then Dr. Abby, or if anyone from Houston Health Department want to jump in, you can as well. So we have a standing physician's order to perform tests until October 16th. What happens after this date? So I'll speak from a TEA DSHS standpoint. We are currently internally having discussions to give you all the best guidance, because we do know that this is a concern, especially for school nurses. And so we will be, we anticipate being able to release a formal statement and guidance very soon. And so that'll give you some guidance there, and it'll be in time enough by October 16th. So I don't know if you had anything to add to that, Dr. Abby, from a Houston Health Department standpoint.
Yeah, and thank you again, Damon. That also applies to Houston Health Department and those that would be engaging with the antigen testing. But when it comes to the PCR, you wouldn't need to bother about the ordering physician, because that's already taken care of at the department level.
Got it.
And hope that answers Marcella's question.
Got it. And then I think that's all the questions. I think everything else we answered live. So we still have about 9 minutes. So if there are any more questions or anything, anyone from the Houston Health Department or TA Additions wants to add, feel free. We still have about 9 minutes left on the webinar. Sorry, I was on mute. Dr. Abby, someone says, please explain about if it is a PCR related to MD order.
Please explain if it's a PCR related to MD order. Oh yeah. The question is, would you need a physician order if you have a PCR testing going on in your school? And if that's the question, the answer is we have that already catered for. We have that already taken care of. For the whole city of Houston, we have a public health authority and we have a physicians within the Houston Health Department whose number and registration covers for all the PCR tests that will be conducted within schools within the city.
Thank you. And then I see I was on mute, so I don't think, obviously you couldn't have heard me. I think if it's not the same hand raised, but I think Shannon from Dishes had maybe something else to add. I see a hand raised. So you can go ahead and come off from mute, Shannon.
Sorry, I just forgot to lower my hand.
Okay, got it. I didn't know this. No worries. All right. So we'll remain on. Don't want to force any questions, but we'll remain on for some more minutes and take it till 2. But if there's still some more questions or some clarification, please let us know. While you're doing that, just want to point everyone back to, for more information, where to go to each agency if you have specific questions. And to encourage those who are interested in the TA COVID testing project for Antigen Test, please, we ask that you just visit our website because there's a ton of information there for you. And if you still have questions after perusing and scrolling through the site, feel free to reach out to us at COVID Case Report.
And also to add that after the call, we would also be sharing the link for anyone who would any school would want to participate in the PCR test. And should you have not received a link, an invite, and you are here probably registering through the TA, it would do us a lot of good if you can just put in your email address in the chat room, and we would also add that to our repository and get across to you.
And then, Dr. Abbott, you mentioned the link. That's this link that I'm pointing to on the screen?
Correct.
Got it. And I'll click on it again just for those who might have joined a little later and didn't see that part. This is the link she's referring to for PCR testing.
Correct.
Okay. Well, don't want to belabor it. So if there aren't any more questions, then we can end a little bit early. So I'll give about another minute or two. Speak now or forever email us. Check out the website. We'll give about another minute or so, and then we'll end the webinar. All right. Well, I don't think I don't foresee any more questions coming. Thank you to everyone that joined the webinar today. We appreciate you being here. We hope that we're able to support you with your antigen test needs in terms of from a TA dishes standpoint. Dr. Abbott, I don't know if you had any final words you wanted to share.
Yes, we look forward to supporting all the schools on the PCR testing. Please get across to us, and we are here for you.
Thank you all so much. Enjoy the rest of your day, and we will be in contact soon. Thank you.
Bye-bye.